So I'll give just a very short introduction to set the stage a little bit and not to repeat what the subsequent speakers will talk about. But just to set the scene a little bit, and maybe starting from the basics, why are we so concerned about PABS? Why is it so important? For public purposes, I think it's self-evident. The sharing pathogens, having the availability of the physical samples and increasingly of what we call digital sequence information is essential for public health purposes. Identify the pathogens, characterize the pathogens, and most importantly, starting working on medical countermeasures, vaccine, therapeutics, and diagnostics. So the importance of this sharing for public health purposes is evident. And we haven't put it in the brief for purposes of brevity, but it came to my mind that Suri and I co-directed a research project that ended just at the beginning of COVID on trying to reconstruct the practice of sharing, because we didn't know much. Besides influenza, that is more transparent, more codified, if you want, we didn't really have much of an idea of how researchers, scientists, institutions shared, what they shared, why they shared, how they shared it, what are the benefits for them, and so on. And so we did this empirical project that showed a number of things, and I just want to mention them because when you negotiate something like you are, and we are trying to support it, you take a step back and it seems something a bit vague or just political. But obviously there is a human face and there is a lot of practice behind it. And some of the findings we arrived at, the first is that obviously many researchers get specialized in particular pathogens. There are people that make the career studying HIV/AIDS, malaria, Ebola, hemorrhagic fevers, and so on. And so they create communities globally of scientists and researchers studying the same things. And these communities, obviously, they need to work under the laws of the country, whatever international law is applicable, but they develop their own self-regulation, their own soft practices on what are the assumptions, what are the principles that guide what they are doing. So I think we should also keep in mind that there is a lot of if you want soft regulation going on, these are the rules of the game, of the daily sharing of pathogens around the world. The second is in particular for international projects, because there were many projects in developing countries or countries where these pathogens were prevalent. And some of the findings that we got from the interviews, it was a very empirical project, was first the importance of clarity of expectations, the importance of personal relations and trust. Trust was repeated over and over and over. And interestingly, that sometimes sharing animal pathogens was easier than sharing human pathogens, in good part because of the fewer expectations of economic profit down the line. But so there's all these elements of human relations that in a way governs the whole system of what we call PABS. And then finally, that we found, at least I found it surprising, and we put it in the brief, a diversity of expectation what benefits are. In a way, sharing and access is more self-intuitive. You send a computer file or a glass tube to another laboratory. But what people expected in return was quite different. There was a diversity of view. For some, it was really academic. I'm a university, so what I would like is co-authorship in a paper, participated in a grant, recognition of my institute, and so on. For others, it was economic, was getting money back for the institutions and so on. For others, it was more systemic. Capacity building for the institution, for the government, or even the fact that health security is improved. So we find it quite interesting that the expectations of benefit was quite diverse, quite reflecting probably a personal relationship and expectations. And then the final point, and so the title of our report in the second bullet, and you find it on the website of the Global Health Center. Not the governing pandemics, because this was concluded before the governing pandemic was established. The last point that leads me to my next slide is some nervousness and uncertainty among the people we interviewed at the what would be coming in terms of governance, in terms of law, and so on. The awareness, the need for legal clarity and a level playing field between sharing and benefits, but some fear about overregulation that would stifle science, would in a way have a chilling effect on research, on the freedom of sharing. And that takes me to the second point of what happened that leads us to this negotiation. And here I keep it brief because Mark Eckerson-Turner will elaborate on this point. But as we put in the brief, fundamentally two developments. The first, and Sherwin alluded to it, is the increase in acceptance that pathogens are genetic resources under the Convention on Biological Diversity. So by default, that regime of international law applies to the sharing of pathogens and to the sharing of benefits. You all familiar, I assume, with the principle of the CBD, national sovereignty of genetic resources, the right to regulate access to it, the need for the government to authorize it, the need for the recipient and the provider to agree on terms, this sort of bilateral bit transactional approach of the CBD, and the equal footing between sharing and equitable sharing of benefits. So as Sherwin reminded us, Indonesia in a way was the first to jumpstart this process that lead to the PIP framework as a first attempt to set up a multilateral framework for the sharing of a subset of a particular set of pathogens, so just influenza with pandemic potential. But it's been hailed as a model, and inevitably, I think also negotiator, you in the EIMB must have looked at the PIP as a possible model, as a possible blueprint, multilateralizing it, putting access and benefit on the same footing, and putting also WHO at the center of this multilateral scheme, as a manager, as a steward, as a guarantor of the integrity of the system. The second is, as you know very well, the increasing availability of digital sequencing technology, which was the case in 1992. That's why the CBD doesn't even mention it. It's become widespread in many parts of the world, and so it raises a number of additional challenges. First, the fact that the main instruments, the CBD, the Nagoya Protocol, and the PIP don't specifically mention it or regulate it, so some uncertainty as its status. The second is there been a proliferation of databases where the sequences are filed, private and public. We mentioned the main two in our report, GSAID, that was the database of choice during COVID, but also the INSDC, collaboration on other databases, but there are hundreds. And so one of the challenges, I think, will be what to make of it in building a PABS system. And finally, just the sheer volume of sharing or posting of millions of sequences and so on. So all these two elements, in a way, have complexified, I don't want to say complicated, but certainly made more complex the international regulation of pathogen and benefit sharing. And things are moving in the biodiversity space. As Mark Eckerson-Turner will mention, the creation, or in principle, of a multilateral system under the CBD, and the creation of the so-called Cali Fund to get benefits from the sharing of genetic sequences. And for those of you that have been following the debate in WHO in the last 10 years, maybe not so many, but some of you in the room, there's always been a bit of it looking at each other. WHO did not want to go ahead of the CBD obviously taking its time with these political difficulties. So it's been a slow progress on the two fronts. So here we come to the current negotiations. I'm not going to describe Article 12. I assume that you read it, and I think Mark will elaborate a bit of it on its content. But fundamentally, I think there is a I don't want to say an absolute consensus, but quite a solid consensus that the bilateral approach of the CBD is not the best for public health, certainly not the best at times of emergency, when you cannot negotiate access to something while a pandemic is raging. You need something clearly defined, multilateral, with clear rules of the game agreed in advance. So the negotiation of the pandemic agreement has been a unique opportunity to put that in practice. And I put on the slide what seems to me some of the three main, or some of the main challenges. First, how to make it fit within the regime of biodiversity, so there is no conflict, but also there is no default falling on this. I'm sorry, I changed, yeah. I changed the slides on my computer, but not on the screen. Very smart, I'm very sorry. The second is how the role of the industry, in a way, and how to regulate or encourage or whatever, what the industry can and should do through a treaty where the parties are states and not companies. And the second, obviously, which I think was the main challenge, was this balance between access and benefits, something that would not stifle scientists, but at the same time have clear guarantees or equitable sharing of benefits. We do quantification of benefits in Article 12, the certain percentage of health products to be shared during a pandemic, and so on. And so finally, clearly, the PABS is a precondition for the whole agreement, so much so as speakers before me have recalled that the whole agreement is frozen until you conclude this annex. That is quite an unusual outcome for a treaty, but it clearly embodies the political and legal and operational importance of PABS. And also, it's a centerpiece within its cluster of articles. And we had a previous publication on that, Article 9 to 14. These are really, if you want, the health products articles are probably the centerpiece of the agreement, and they all interlocking with each other. We made a couple of examples in the brief. The clear relationship that hopefully can be mutually strengthening between research and development, spread of manufacturing capacity, technology transfer, access to pathogens, and the benefit that could sustain some of these activities and so on. So there's a lot of synergy to be taken in mind as you negotiate this particular aspect of the package of the agreement, but also synergy not to be lost and to be strengthened to aim at an effective agreement down the line.